Aloha, friends, peers, and esteemed colleagues. My name is Rocky Russo. I'm a health and nutrition coach, yoga teacher, and business operator. I've been assisting people with their health and fitness goals for over 15 years because I understand the value of healthy habits and physical activity. In all of my years of prioritizing fitness through physical activity, nutrition, knowing and believing the healthy benefits of leading an active lifestyle, I must say that it is such an amazing time to be in this field. Medicine is finally catching up to what we have known and been practicing for years. Preventative medicine is the new frontier, and healthcare is paving a path for wellness professionals such as you and I to shine, doing what we love under the lens of health and longevity rather than just of leisure, aesthetics, and sport. Organizations such as Play 60 and Adventure Capital have been quietly leading the charge for the promotion of movement through the ages. Only over the past few years have programs such as Exercise as Medicine and Physical Activity as a Vital Sign started to really start pushing from the bottom rather than just pulling from the top. It is clear that physical activity is a necessary component to health and wellness, and it is absolutely imperative that it finds its position as a staple in the patient care and prescription protocol in the health and care industry. Well, let me tell you why. According to Exercise as Medicine, inactivity caused over 5.3 million premature deaths in 2008. Only 57 million people worldwide died in 2008. Inactivity causes 6% of the global burden of disease from coronary heart disease, 7% of type 2 diabetes, and 10% of breast and colon cancer cases. Despite these absurd facts, only 44% of Americans are meeting the measly daily activity requirements. That's over half of our population too uninspired to get up and live. Mind you, the requirements for physical activity sit humbly at a mere 150 minutes a week of moderate activity, or 75 minutes of vigorous activity. I aim to believe that you and I both would get that in one exercise setting, one day. That's why it's up to us to be the change that we wish to see here. According to the CDC, our healthcare industry wrote over $234 billion in prescription drugs in that same year of the previously stated statistics. This allows for 9 out of 10 older Americans and 1 out of every 5 children to be doped up on a far less effective medicine than that of exercise. Now, how can I declare this in such confidence? Not only because I have felt it in myself and assisted in countless clients' discovery of this medicine for themselves, but because the studies also prove it to be so. According to the Swedish National Institute of Public Health, exercise has been proven beneficial as a treatment for over 30 different disorders. Here are just a couple of examples that hit close to home for me. Alcoholism. I have a handful of friends, clients, and family members who have suffered from alcoholism. In one study conducted on patients during the withdrawal phase, it was seen that brief sessions of exercise, just 10 minutes of cycling, led to cautiously mild but temporary effects on alcohol cravings. Otherwise, clinical experience suggests that physical training in the acute stage alleviates somatic withdrawal symptoms, leaving someone to feel more at ease during this terrible phase of getting over their drug. Several studies have shown a significant decrease of the shakes, sweating, and reduction of anxiety following organized low-intensity fitness training. On top of this, exercise has been shown to assist in a better night's sleep for alcoholics going through a detox phase. Anxiety. Another one of my soft spots lies in my friends and clients suffering from anxiety and depression. This disorder has become far too prevalent in first world countries, and much of my research has shown that it is directly related to an abundance of time without purpose or meaning. Again, according to Swedish National Institute of Public Health, it was seen that after 20 weeks of lifestyle change programming, which included regular activity, patients had significantly reduced anxiety levels and fewer panic attacks. And after 10 months, the lifestyle program group still showed better results than the control group. So, exercise. These are just a couple of examples of the ways in which physical activity can serve to improve the health and wellness of individuals with specific diseases and disorders. As integrative wellness professionals in a field that is slowly but surely becoming more progressive in our attempt to further cultivate a healthcare environment which champions a preventative approach to wellness, it is imperative that we continue fostering avenues in which our clients, patients, and friends can choose and be encouraged to join a modality of physical activity that will see them through to sustainable habits of wellness. As trainers, we must show up each day with passion and conviction for what we are doing and what we are representing in order to inspire and empower our clients to allow for them to excel in their lives. As yoga instructors, we must find innovative and proven ways to continue inspiring peace through embodied movement and quiet minds, actively transpiring a message of love and meaningful movement. As nutritionists, we must continue digging through the surface layers of health to test, retest, and prescribe the most customizable nutrition programs around. The one interwoven thread of similarity between these and all integrative wellness modalities, which must be heard and understood, is that of service. Because we are the rare breed who actually enjoys and needs physical activity in our lives, does not give us the right to pursue these careers solely because we find enjoyment in the workday. It is so that we can help others to find the same type of love and fulfillment that exists in themselves once they discover the style of physical activity that will keep them healthy, happy, and energized, and out of the hospital. Thank you again so much for tuning in. This is Rocky Russo. Hope to talk to you soon.